Good afternoon, and thank you for being here. We're here to give an update on COVID-19 and our next steps to stop the spread. I'm joined by Dr. Dean Seidlinger, our state epidemiologist, and Rachel Banks, the public health director at the Oregon Health Authority. We've seen over the past few weeks that COVID-19 is spreading in Oregon, and unfortunately, it's spreading at an unprecedented rate. It's extremely concerning. Day after day, we hit new record highs of cases, topping more than 800 yesterday. It's alarming that the majority of these cases are not linked to any specific outbreaks, but rather reflective of sporadic community spread. The virus can very quickly snowball out of control. We're seeing that in real time, and certainly lives are at stake. Governors across the country are echoing this cry, from New Mexico to Ohio to Rhode Island. Oregonians have made incredibly difficult and tremendous sacrifices to help each other throughout this pandemic, which is why Oregon has done relatively better than many other states on containing the virus. But we cannot let up now. In fact, we have to go on the offense to stop the spread. That's why I'm announcing a 2-week pause on social activities for counties with more than 200 cases per 100,000 over a 2-week period, or more than 60 cases for counties with less than 30,000 people. Today, that includes Malheur, Umatilla, Marion, Jackson, and Multnomah counties. There are 5 additional counties that are on the cusp of meeting these metrics: Washington, Baker, Union, Clackamas, and Lynn counties. We will be pulling data for the whole state on Monday, but in particular for these 5 counties. Should they meet these metrics, they too will begin a 2-week pause. The 2-week pause is a first steps in our efforts to control the virus. This series of measures is intended to curb human contact, both through reducing the sheer number of people we interact with and the frequency of those encounters. It includes a pause on long-term care facility visits that take place indoors, reducing indoor restaurant capacity to a maximum of 50 people, including both staff and customers, and reducing group sizes that may be seated together to 6 people. Outdoor dining and takeout are encouraged. It also includes reducing all indoor recreation activities to 50-person capacity, including gyms, fitness, and museums. I want to clarify that this pause does not change any of the current rules for faith-based gatherings at this time. We're also directing all businesses in these counties to mandate that staff work from home to the greatest extent possible. Additionally, indoor social get-togethers will be limited to single households only, or a maximum of 6 people during the pause. We've been asking Oregonians over the past several weeks to be mindful of social gatherings as they continue to be the main culprit of community spread in Oregon. The data is proving that not all Oregonians are listening. For example, having dinner with 5 friends one night, inviting a few family members over the next day, and then meeting up with your neighbors later that week. While each of these gatherings may be less than 6 people, together, these interactions drastically heighten the risk of exposure. So let me be very clear. For this 2-week pause, please, please, please limit your social interactions to your own household. For those of you who have scheduled events with other people for the coming weekend, please cancel them. We need your help. From our outset, our goal has been to save lives and avoid overwhelming our healthcare systems. When people become ill, we need to ensure that there are enough hospital beds, PPE, and staff to provide much-needed life-saving care. If we don't start to see the spread of COVID-19 slow in our communities, we will be well on our way to maxing out our hospital bed capacity. The 2-week pause will go into effect this coming Wednesday, November 11th, and continuing through Wednesday, November 25th. I need all Oregonians to understand that additional closures may be imminent in 2 weeks if we don't see reduced case counts. My sincere hope is that we can work together to drive down the numbers before the Thanksgiving holiday. Please, if you are making Thanksgiving holiday plans now, use these social limits on social gatherings as your guide. If you've already made plans that don't fall in this guidance, please change them. This is a wake-up call. I do not want to have to take further actions to stop the spread of COVID-19 because I know it will have a devastating impact on our businesses, both large and small. But I absolutely will, if necessary, to protect the health and safety of Oregonians. I'm also calling on Congress to pass another COVID relief package immediately upon returning to Washington, D.C. It would include another $600 in enhanced federal pandemic unemployment compensation due to the increase of COVID-19 cases both in this state and across the country. I know that any restrictions to our restaurants and businesses is extremely difficult for many people. I do not make these decisions lightly. It keeps me up at night thinking about how we're seeing increased case numbers and what actions will be necessary to stop the spread of COVID-19 here in Oregon. However, we must stop this virus from spreading. We must preserve our hospital capacity, and we must save lives. I will now turn it over to Director Banks to go into further detail about the metrics. Director Banks.
Thank you, Governor Brown. So Rachel Banks, I use the gender pronouns she, her, and hers, and I'm here to talk to you all today to give you an overview of where we stand in this pandemic and why this pause is needed now. Then I'll turn it over to Dr. Seidlinger, who's going to talk more about when, where, and how the pause will happen for the 5 counties that Governor Brown mentioned. So I joined state public health here at the Oregon Health Authority last week. And that's after spending 3 years as Multnomah County's public health director, where I worked with a fabulous team of people who did case investigation, contact tracing, outreach, and education for the state's most dense and diverse populated area. So first, I want to thank you. I want to thank Oregonians for the work that you have done thus far. I see and we see how hard and how relentless the work is that people have done in the community, at the county level, and at the state level to stop the spread of COVID-19. I'm grateful for the efforts that the majority of Oregonians who are wearing their face coverings, seeing family more remotely, less family in person, more FaceTime, more Zoom calls, as well as friends, and ultimately who are practicing physical distancing when you're in public spaces. I also want to acknowledge and appreciate the many businesses who've made alterations that have protected their patrons and supported their employees. We see and understand the sacrifices that so many Oregonians have made, and those efforts have not been in vain. Twice now, Oregonians have stopped a surge of COVID-19 cases. The first time in March, Oregonians followed Governor Brown's executive order to stay home and save lives, and that's exactly what we did. And then again in the spring, when Oregonians put on their masks and their face coverings to slow another spike in cases. Those things worked. And since the start of the pandemic, Oregon has remained one of the lowest, has one of the lowest case rates in the nation and has remained a bright spot in the nation's troubled COVID-19 pandemic response. And that's all through your shared efforts. But now we're in a place, as Governor Brown said, where we face a critical moment in the fight against COVID-19. We see the virus is on the march across the country and across the globe and the nation. And as the weather worsens, as the days get shorter, as more people are indoors and we're observing holiday seasons, we are all at a greater risk. So let me tell you why this is so important now. I'm going to review some of the latest data and trends. Today, Oregon is reporting 770 new cases of COVID-19. That's for a total of 48,602 cases. And I'm devastated to tell you that today we have experienced 6 more deaths due to COVID-19. That brings our death toll to 716. Today's numbers are a continuation of the dangerous and escalating situation. Yesterday, we recorded another record-breaking 805 cases and 5 tragic deaths. And over this past week, Monday, October 26th through Sunday, November 1st, OHA recorded 3,542 new cases of COVID-19 infection. That's up 34% from the previous week. 37 Oregonians have tragically died in the past week in association with COVID-19, and that's compared to 27 the prior week. And 160 were hospitalized. The number of newly tested Oregonians rose to 34,591, and the percentage of positive tests rose sharply to 8.4%. That test positivity is another troubling sign that the virus is spreading at a more rapid rate and that more people will become infected in the coming days and weeks if we don't do something right now. We're also seeing alarming data from our hospitals. Yesterday, hospital census statewide for COVID-19 patients was at the highest it's been since the pandemic, with 204 positive COVID-19 patients and an additional 55 patients suspected with COVID-19 in hospitals statewide yesterday morning. These COVID census numbers have consistently risen over the past week, and coupled with the rising counts and the modeling projections, this number will likely increase. While hospitals have been managing at a high census throughout the fall, it appears that the increases in the COVID-19 census, along with staffing shortages, have increased the concern for us. And so last night, we've seen in the Portland metro area that Region 1 hospitals were at over 90% of their ICU intensive care unit capacity. While we're not hearing about capacity shortages in other regions, the major hospital systems are convening this afternoon to discuss the situation in keeping with Oregon's statewide emergency plans. But now it's not too late to reverse the tide, and that's exactly what we have to do. As Governor Brown stated, it's time for a new approach. The statewide framework that we've had in place to reopen isn't enough to guard against this new wave of infections. And so we're developing a new strategy and a new approach that better targets interventions at the local level where cases are threatening to boil over and strain our hospital capacity. But I want to be clear that any strategy and any local strategy requires state and health officials, anything that we deploy requires all of you as Oregonians to take action. As Governor Brown described, these social gatherings, informal parties at houses and other places remain the primary vector of COVID-19 transmission. As Public Health Director in Multnomah County, I often heard our case investigators, contact tracers, and epidemiologists talk about the increase in cases and outbreaks that were associated with these social gatherings or household contacts. And we continue to see that. I'll share with you a couple of examples that we've seen in recent days from social gatherings and just the potential spread that they have. So a Halloween party has led to at least 14 infections. After people went to the party, the virus spread further to a workplace outbreaks that we're continuing to investigate. We expect more than those 14 cases to ultimately be associated and diagnosed in the coming days. Another example that we're investigating is an outbreak associated with a family party. Multiple people attended the party when they were infectious, and 9 additional cases came from that. From there, after people went to the party, the virus then spread and has led to 2 long-term care facility outbreaks where there are a total of 24 cases and 1 tragic death. And unfortunately, we expect more cases to be diagnosed in the coming days. I know as a state we've been through a lot. This has been such a tough week. And I know all of us want to be spending more time in person with friends and family now more than ever. But now is not the time that we can give into the fight against COVID-19. And as we enter the holiday season, this pause is a good time for all of us to think about how we're going to modify our choices and behaviors so that we can protect those that we most love and care about. And with that, I will turn it over to Dr. Dean Seidlinger, who's going to describe what this pause means and how we're implementing it.
Thank you, Director Banks. Thank you for that summary of the situation in Oregon. I want to reiterate my thoughts for all of our neighbors currently impacted by COVID-19. That includes those who are sick, as well as their families, friends, and loved ones. Even more, Oregonians are anxious and fearful about getting sick, and the economic impacts we've seen from COVID-19 across the state and the nation are great. So my thoughts go out to everyone who's been impacted. I also want to express my gratitude for all my public health colleagues and our healthcare partners who have been fighting this virus since the beginning of the year. Their work is not unnoticed, and their work is getting tougher. As Governor Brown said, we're pushing the pause button on counties that have rates of over 200 per 100,000 over the last 2 weeks, and our smaller counties that have had 60 or more cases in that time period. These cutoffs were chosen as they align with our school metrics. And at this time, as you heard, they affect Jackson, Malheur, Marion, Multnomah, and Umatilla County. In keeping with our regular practice, we will update our data on Monday for the previous 2 weeks, and we expect that more counties may fall onto this cutoff and will be added to this pause, which takes effect November 11th. Director Banks told you why the 2-week pause is necessary, and I want to tell you the reason we focused on the specific steps that Governor Brown outlined. We want all businesses to mandate a work from home to the greatest extent possible. It's important to minimize contact with others, and when we come to work, we spend a significant amount of time, up to 8 hours, in close proximity to our coworkers. So if we can minimize that interaction, we can slow the spread. We want to reduce the total number of people indoors at restaurants and other indoor entertainment activities to 50 people, because we know that COVID-19 spreads more easily in these indoor settings, especially when people cannot keep their masks on, such as when they're eating or drinking. That's why we also continue to urge restaurants to offer takeout options and to serve people outside where the risk is lower. We want to pause visitation at nursing homes and other long-term care facilities in these counties to protect some of our most vulnerable fellow Oregonians who have the highest COVID-19 fatality rate, who are at the greatest risk from community spread getting into those facilities and carried into their residences. And most importantly, we want people to gather indoors less often, in small groups or with fewer people. So over the next 2 weeks, limit your social interactions to those in your household. If you do socialize, limit those gatherings to 6 people at a time. And we're asking you to dramatically cut back on your social gatherings that you attend over the next 2 weeks. Our recent survey showed that Oregonians, about half of them, are limiting themselves to 3 or fewer social gatherings every 2 weeks. And that's a good benchmark for us all to keep. Limit those gatherings to 3 or less over 2 weeks. These steps can help to keep COVID-19 from spreading through social gatherings and tamp down the skyrocketing rates that we're seeing in the counties that we're putting on pause. But they're really steps all Oregonians can and should take. While we're focused on these 5 counties with the highest risk and the recent surge in cases, I urge all Oregonians to heed this advice. This is especially true in the Portland metro region, including Clackamas and Washington counties, which are still in phase 1 and seeing rising cases. We all have a role to play, regardless of the county we live in. Finally, we know the holidays are coming, and that's a time when we long to be with our families and friends. It's also a time that we're at greatest risk. You don't want to bring COVID-19 home for the holidays and get a loved one sick. You don't want a family member to suffer through the symptoms that come along with COVID-19, to miss work, or worse yet, have severe illness necessitating hospitalization, or even die from this virus. Remember, the death rate from COVID-19 is not like the flu. It's 20 times higher than the death rate for the flu. So what do you have to do? I think you need to follow. As a follow-up to our COVID-19 survey, we've been having conversations with people from across the state, our rural Oregonians, to our young urban dwellers, our people who speak Spanish and other languages, and our tribal members. And they're telling us that they haven't made their holiday plans yet. So we're asking you, if you haven't made those plans, stay home, gather with your immediate family, and connect with loved ones in other ways. If you've made those plans, change them. Postpone that in-person gathering with your family. Postpone seeing those best friends you haven't seen for a while. The safest activity is to stay at home. And while it may seem a good idea to get a COVID test before you go anywhere, it's important to note that a negative test result is not a free pass. Some COVID-19 test results produce false negatives. So you may test negative, but still have the virus, and you still need to follow any stringent protocols for travel and when you see your loved ones. So consider holding virtual dinners, parties, and celebrations with loved ones and friends. Instead of having the family over for the traditional holiday meal, schedule a time to meet virtually with each other and share that opportunity to catch up, share your favorite Thanksgiving memories and Thanksgiving recipes. Limit your exposure to non-household members for 14 days before visiting older relatives who are at higher risk for infection. This self-quarantine period can reduce but not eliminate risk. And that's why we're asking you to cancel those gatherings. But if you do decide to go forward with them, that 2-week pause personally can help to keep your loved ones safe. So as always, follow these simple advice. Wear your mask whenever you're outside of the house and can't be at least 6 feet from others. Keep 6 feet of distance from others outside of your household. Wash your hands frequently and try not to touch your face. And keep apart and keep in small groups when you're outside of your home. It's not too late for all of us to take these steps. An additional step is visit the pharmacist or your doctor to get your flu shot and protect yourself from one of the diseases. We have protection right now. And when the COVID-19 vaccine becomes available for the public in Oregon, take the vaccine. We are going through steps now to ensure that it's safe and effective. So that's another step you'll have in the future, but it's not there now. So these other simple steps are what you need to do. With that, I'd like to turn it back over to Governor Brown.
Thank you, Dr. Seidlinger. And Charles, I think we're ready for questions.
Great. We'll start out with Lachey Wesley from K2. Go ahead, Lachey.
Hi, Governor Brown. I wanted to ask you about this new measure. What are the consequences of this? Is there any, follow-up if people, go and have these social interactions or anything like that?
These new measures will be put into guidance with the Oregon Health Authority, but the consequences are the community impacts, honestly, that our cases are likely to continue to increase, that we're likely to see more deaths, unfortunately, and frankly, as Director Banks mentioned, we are beginning to stretch our hospital bed and staff capacity here in the metropolitan area. So the consequences are the impact on our community and on our state and frankly the whole country.
And I also wanted to ask you about businesses putting these new restrictions on restaurants, other businesses. Is that driving more people into private indoor settings? And also, are you talking with business groups to see how these new regulations are impacting them? Are they included in the discussion?
So the goal of this 2-week pause is to help stop the spread of COVID-19. It's to reduce the number of people that we interact with, and of course, to reduce the frequency of these interactions. I am taking these steps and calling upon Oregonians to really restrict their informal social gathering, to limit it to that of their own household, otherwise limited to 6 and under. If I do need to take further steps, it will involve further restricting business activity, and I don't want to do that. It's honestly up to each and every one of us, particularly those in the 5 counties that we have been talking about where the 2-week pause applies, and frankly, other counties that are on the cusp, Washington, Clackamas, Baker, Union, and Lynn counties. But it would be great if the entire state began to and took these directives seriously. We are seeing statewide community spread. It is sporadic, and it's really challenging. Dr. Seidlinger, do you want to add anything?
No, thank you, Governor Brown. I think, changing our behavior is very difficult, especially around this time of holidays and when we're moving inside. We've been dealing with this virus on some level since January, and we, entered into our Stay Home, Save Lives in March. So that's the vast majority of 2020 that people have been asked to limit their activities, to visit virtually with grandparents and older relatives, and we know it's taking a toll. But we also know that disobeying that guidance and getting together with groups of friends and family and catching up and sharing good memories, having a drink, having dinner together, do increase the risk of spread. People are not doing this intentionally. People are not going out when they have symptoms or when they know they've tested positive. This is really people who have no symptoms. Either they haven't developed them yet or never developed them. They get together with the people they love, the people they trust, and they think, surely I'm not going to get an infection from my best friend, from my aunt, from my sister. But unfortunately, that's what we're seeing. And as cases rise, we are seeing more cases we can't trace back to a spread. And that's because more people are out there without symptoms. And our public health investigations are stretched. For each case that we identify, we have someone interview them. We have them link them to services. We talk to them about what they need to do. And as cases increase, the people and the resources we have to do that are stretched. So those 2 things are leading to these increased cases. So we need everyone working together to get them down, as Governor Brown said.
And in terms of enforcement regarding the businesses, we're going to continue to work collaboratively with our state agencies, including OLCC, Oregon OSHA, and our licensing board to make sure that businesses across the state are in compliance. I know that we unfortunately have had to crack down on some businesses that were not complying, for example, with face covering orders. But the good news is that the vast majority of both retail, pharmaceutical, and personal services have continued to comply with the guidelines. But certainly we will need to continue our enforcement efforts, and I'm absolutely committed to doing that. But the reality is I shouldn't have to. These measures are put in place to save lives and protect the health of Oregonians. We are truly all in this together, and the impact of our actions impacts others every single day.
Thanks, Lachey. We're going to go next to Lisa Balick with COIN. Go ahead, Lisa.
Yes, Governor, why impact businesses economically, again, like restaurants, when the highest number of cases now are in the 20 to 29-year-old group who are spreading it through private gatherings, like in homes and apartments? Is it because you can't do anything about them?
Lisa, to be honest with you, the goal of this pause really impacts the level of community spread we are seeing. Certainly businesses are impacted because we are reducing capacity, but from my perspective, this is a next step. Should we continue to see community spread continue and the amount of cases continue to rise, then I'm going to have to take further restrictive measures on our businesses. I don't want to do that. I don't think it is good for our economy. It is challenging for our businesses, both large and small. That's why I'm asking Oregonians in these 5 counties to step up and really take this 2-week pause seriously. In terms of other measures, We know, obviously, that the spread is occurring most frequently in young people under the ages of 40, and I'll let our experts talk about that. I think this is really hard. We know this. We're seeing increased cases across the entire country. Idaho easily has twice as many cases we do with substantially less people. The spread is far and wide of this virus. But I'm asking Oregonians, young and old, to double down on their efforts to protect their family members, to protect their neighbors, and to protect their communities. Anybody else want to take it?
Yes, thank you, Governor Brown. I think, let me talk about the bars and restaurants a little bit. You know, we don't take these recommendations, these guidance lightly. We know the economic impacts they have on businesses, on the employees who work there. We know that many of those employees are nervous about coming to work. And that's why we have important safety measures in place, and our businesses are following those measures. But what we also know is that in a setting like a bar or a restaurant, when you're indoors, you need to remove your face covering when you're eating and drinking. And so large numbers of people without face coverings in an enclosed space can lead to increased spread. We've seen that in other countries and in other states. We do know that many of our folks who report getting together in informal social gatherings also report getting together at bars and restaurants. And while it's very difficult to definitively kind of trace the spread within a bar or restaurant in a particular city like Portland, we have overwhelming evidence that these are settings that do promote the spread of the disease. So we know that bars and restaurants can move some folks outside and reduce the risk. Even in the cooler, rainier weather, we can still do some of that and lower some risk. That patronizing the bars and restaurants in your neighborhood for takeout and bringing that food home can help to lessen some of that economic impact, but not eliminate it. So these are very hard choices we've made, and that's why we work very hard for folks who are impacted by COVID-19, either have the virus themselves or are a contact, to link them to services, and why we've worked across the state to try and link businesses and others to the resources that are available, and we're hoping for more of those resources to really help us with our struggling economy because of this virus.
Why wait until Wednesday?
So we know that these are going to have tremendous impacts on businesses that have ordered food, plan for what's happening in the weekend. So we want to try and lessen that impact by giving some notice to businesses as they move forward. Yes, we are recommending that people stay home and limit their gatherings, and we would like for them to do that starting now. But if they can, consider ordering that takeout meal, getting that pizza to go, or other things to try and patronize these businesses. But we wanted to give them some time to prepare for this next phase.
Thanks, Lisa. We're going to go next to Aaron Ross with OPB. Go ahead, Aaron.
Hi, my question is for Dean. Looking at the model that was released last week, that model expected in the worst case scenario, increased transmission to be about 5% higher than it had been the previous week, and was expecting to see like about 500 cases a day max. And of course, in that model, it did acknowledge that it didn't include data for the second half of October where cases rose dramatically. But just knowing that our hospitals are rising and looking at those really elevated numbers, I mean, can our models are we able to do models fast enough right now to make accurate predictions of things like hospital capacity?
Thank you for that question. I think, our modeling does have its limitations. We have been using our current modeling that's a partnership with IDM in Washington for some time now. And we have as much data from Oregon cases, hospitalizations, and deaths as we can. But we know that hospitalizations lag, deaths significantly lag after someone gets infected. And so the modeling can only do so much to help us plan for the future. They give us an idea of where we're going. And then when we present that model, as we know we have additional data in that following week, we can kind of make some predictions on, are we on that as-is trajectory, or have we already seen some increase in cases? And so that's why last week when the model came up and predicted we had an as-is scenario, a more optimistic scenario, or a scenario where transmission increased, we were pretty sure we were on that increasing transmission scenario. As it turns out, our cases have risen higher than the model showed, and as you pointed out, that's a limitation to our model. We use this model to help predict cases and hospital capacity. We also look at our daily censuses in the hospital and have regular conversations with our hospital partners. So as we saw those increased numbers in the Region 1 Portland Metro hospitals this week, that really prompted some increased alarm beyond the increase in cases. Every Oregonian, whether they have COVID or another disease, deserves access to quality care, and we're in jeopardy of being at a place where we can't do that for every Oregonian. And so these actions are necessary to help protect that hospital capacity and ensure it's there for everyone who needs it.
And so just looking forward and looking at kind of where we stand relative to that worst case scenario, do we have any idea like where our effective transmission rate is? Are we looking at, is it within that like threshold, the 10% 90th percentile that we were given, or are we looking at a number higher than like 1.2, 1.3?
Right, and right now, our model that range for the effective reproductive number said that with a 5% increase in transmission, we were between about 1.08 and 1.22. I think with our cases having increased over what the model was showing might happen in the middle of November, our effective reproductive number is likely higher. That's not something that we can calculate in the future. We'll see what the next model shows, but other models have continued to show our effective reproductive number gradually increase. These models rely on different assumptions and different calculations, but they've all been fairly consistent in showing that number increasing. But they all have some similar limitations to what our model does, in that they often are based on data from several weeks ago, so we can account for any lag in reporting of cases. And so again, as I've said before when we talk about the model, it's not a prediction of the future, but it's a tool that helps us plan for scenarios. And in this case, we are planning for cases to continue to increase, and that's why we're asking everyone to take these actions so we can help blunt that curve, flatten the curves, as you've heard, and preserve that hospital capacity so it's there for every one of us in case we need it.
Thanks, Aaron.
Are we seeing exponential growth right now? Sorry, that last question. Are we in exponential growth?
I think, exponential growth has a really, defined outcome, and I don't think we could call this exponential growth, but this is a period of significant increase in cases, a significant increase in hospitalizations, and both of those things are putting a strain on our public health capacity, on our hospital capacity, and as more people are out there with the virus, that exponential piece will happen. So we are trying to prevent that, and that's why we're asking everyone to take these actions, even though they're difficult, and especially difficult as we come into the holiday seasons.
Aaron, I'll just say
Thank you.
this is a wake-up call. It's absolutely a wake-up call for Oregonians. An encouragement to keep your gathering small and keep your bubble, your social bubble small. If we don't stop the spread, further closures are imminent.
Thanks, Aaron. We've got quite a few questions in the queue still, so we'll try and get through them. We have just a little bit of time left. We'll go next to Pat Duris with KGW. Go ahead, Pat.
Yes, thanks. Are you folks concerned that people from counties like Multnomah will go to other counties where the limits are not as severe on the restaurants and gyms, things like that?
Thanks, Pat. I'm going to turn that over to Director Banks.
Yes, thank you for that question, Pat. I mean, we're definitely concerned about that, and I think hence why Dr. Seidlinger also asked for the corresponding counties in the Clackamas County and Washington County as well to be adhering to the guidance. But I would also say for my fellow Multnomah County residents to stay local, do the takeout, and not just substitute that with going to other counties. What we've seen in the past, whereby we have different measures in place in different counties, we still see an increase in spread, whereby people are moving from one county to the next.
Thanks, Pat. We're going to go next to Gary Warner with EO Media. Go ahead, Gary.
Yeah, hi, folks. Tomorrow, we're going to have Washington State in Corvallis playing the Beavers, and we're going to have the Stanford at Eugene playing the Ducks. A while back, Dr. Seidlinger said one of his major concerns was informal house parties during these football games. Now, we're not having crowds at these games, but basically, do you regret going ahead and allowing these games? And is this a major problem? And what, if anything, can you do about it tomorrow?
I'll turn the hard part of the question over to the experts, but I just am very excited for the Oregon Ducks to kick the Cardinals in the seat of pants and for our very own Oregon State Beavers to beat the Cougars. So, Dr. Seidlinger.
Thank you for that question, and thank you, Governor, for allowing me to take this one. I think, I am still concerned about gatherings around the games. We don't have crowds in the stands, and I know that's hard for our student athletes, but it's a necessary piece to help control the spread of the virus. When Washington, California, and Oregon were talking to our Pac-12 officials and our individual institution officials across each of the states, we said, protecting the health of your athletes, the coaches, and the staff is very important, but those games are very important to the campus community. So preventing spread into the broader community and also messaging about what to do on game day is really important. So while I'm not going to play favorites, I'll talk about the Ducks a little bit because I just spoke to their local health department earlier today. And they've been very good about sending out messages to people on their email. They have a much broader reach than we do here in public health. Messages about how to celebrate safely for the game, staying home, considering not going to a bar or gathering with large groups of people, and then sending out reminders as the game came closer to remind people of safer ways to celebrate their Ducks and to celebrate Beavers as well. I think, we asked people to heed that warning. We asked them to watch the game, to cheer their team on, but we asked them to do so with members of their own household, ideally from their own home, and turn on FaceTime or other means to celebrate with your friends across the state or across the country rather than gathering in person. So I am still nervous about it. I hope Oregonians come together this weekend and that we won't see huge crowds of people and that we won't be having to ask for additional restrictions for future games.
Now, along those lines, the New York Times is reporting that universities are one of the major spreaders right now, 250,000 cases at 1,600 universities. Here in Oregon, there are 971 cases. 539 of those are at the University of Oregon. Anything to say about that?
Let me first start by saying, our colleges and universities in Oregon have done an amazing job preparing for and implementing guidelines to control the spread of COVID-19. The highest number of cases at the University of Oregon isn't as surprising when we consider that they're also the largest university, so we need to take that into account. Our universities have also been doing a significant amount of testing in many cases on arriving students and serial testing of students who are on campus. So they're picking up more infections and they're picking them up in people without symptoms and who are mildly symptomatic. So that also adds to that increase in cases. But they're going that next step and taking the steps to isolate those people who are sick and to help public health officials respond and quarantine those who may have had contact. Now, we know that, not everyone is following the rules, and we have had reports of parties in the Greek system and other places that have spread the disease. But we know for the most part, our students, our faculty, and the staff at those universities are taking precautions and changing their behavior to slow the spread. But it's unfortunate that we're continuing to see that spread. But I congratulate universities on the steps they've taken and ask them to continue those steps. And we'll see how OSU and the University of Oregon do this weekend and how our students behave. And I think we'll come out of this hopefully feeling good about the actions and the sacrifices they've taken.
Thanks, Gary. We're going to go next to Brad Schmidt with the Oregonian. Go ahead, Brad.
Hi, thanks. Back in mid-October, Oregon's overall case count exceeded the previous high from the summer, and the modeling released in mid-October essentially predicted about where we would be right now. Hospitalizations since October 23rd are up 47%, and they've skyrocketed 32% just in the last week alone. So I guess my question is, based on the evidence you guys have had over the past month, do you think you should have implemented these measures you've announced today sooner?
Thank you, Brad. I'll take that one. I think, we continuously look at the numbers and we look at the actions we're taking and the impacts they have. So for each of these actions we take that impact businesses, they have, the ability to slow the spread of the disease, but they also have negative impacts as well. We also know that people have been making changes and making sacrifices for almost this entire year. And so as we ask people to make sacrifices, those sacrifices are difficult, and we need people to come along with us. So, while we know the shutdown was effective and stay home to save lives really worked, if we had that in place, continued from March, we would see significantly less cases now. But that is not a sustainable solution. So we need to partner with our businesses and partner with Oregonians that we can open up and still do some activities with lower risk and reduce the spread of disease, and do so in a way that people are still able to get out of their houses, able to enjoy some of the things they used to enjoy before, even though they've changed and they're doing it with less people, in order for this to be sustainable. Because we're fighting this spike now, and I know we'll come together, either with additional restrictions or with Oregonians banding together and heeding our advice to gather in less sizes, and the curve will come down. But if we don't keep up with these guidance, we're going to be doing this again throughout the rest of the fall and the winter, because the virus isn't going away. So we make these recommendations to try and really limit some of the negative impacts as much as we can, to ensure that we can get Oregonians to come along with us and make these sacrifices, and do so to protect ourselves and our loved ones, and to ensure that the quality care is there for when we need it. So that's why, as we were looking at hospital capacity, both in that model and in looking at the hospital's beds that are used for COVID and other situations on a regular basis. And as we saw this increase this week, we knew we had to take additional action to protect that. And that's what we'll continue to do, to monitor the data and to implement actions we know we need to take to control the virus, and to try and do so in a measured way.
Just a quick follow-up. I guess rephrasing the question just slightly, are you worried that the growth that has occurred over the past month has put us in a position where it's essentially too late to effectively tamp this down, if we are now in sort of a two-week watch period? Based on the trajectory, it seems as though the cases are going to continue to go up, the hospitalizations are going to go up. And so I just wonder if, had this happened a week or two earlier, because again, these restrictions are they're limiting, but they're not closing businesses, and people are still voluntarily able to do what they want. And so I just wonder, is there any concern that we maybe miss the opportunity to be most effective at slowing spread?
I think, I've been concerned, worried, anxious, afraid since January. That's just baseline. And yes, this increase in cases and the fairly dramatic way it happened, from kind of reaching a new high of 600 just last Friday to now going over 800 and almost reaching 800 over the last 2 days is very worrisome. But I know that the actions we're taking now, while they're not a full shutdown, will limit people's ability to come together and will limit the transmission. I know that Oregonians have come together and made sacrifices in the past, and have limited seeing friends, have not gone to see grandparents in skilled nursing facilities, when we shut down visitation again. And while that has just restarted on an indoor capacity, that limit is coming in place again. I know Oregonians will come together and do this. And if enough Oregonians do not come together and do this, and we're still seeing increases in spread, we'll have those conversations, public health and the governor's office, about difficult decisions that may need to be added on. And we continue to have those discussions. And I'm very happy that we've been able to have a dialogue and to implement measures that help control the spread of the disease, help us be one of the most successful states in fighting this virus, but still allow some ability for our economy to recover, and for people to still have some ability to connect with family and friends, even if we're asking them to do it mainly virtually. So yes, I'm concerned. If we'd acted a week earlier, could we have impacted some of these cases? Potentially, but it's a constant dance of trying to make sure that we have the most effective measures that people will follow, and that we keep as our North Star the ability to protect the health of Oregonians, that they access quality care, and that we're minimizing those who need to go in the hospital, and that we're trying to minimize those deaths. And Oregon has been doing that and been a leader in doing that since the beginning of this pandemic, and I think we'll continue to be in one of those leadership roles.
And Brad, as Dr. Seidlinger has very eloquently said, and Director Banks as well, when we shut down businesses, it has other types of health impacts. As someone who is preparing the governor's recommended budget for the next 2 years, I'm well aware that the actions that I took in March and then again later in the year have been really harsh on our economy, particularly our small businesses. Congress was able to come together, Republicans and Democrats, to create a significant coronavirus relief package that by any measure stemmed a terrible recession in this country, a terrible depression in this country. Just so you know, those dollars run out December 30th, 2020. And at this point in time, I have grave concerns about whether our Congress and our federal administration can come together on a new package. And Oregon is not the only state in the country facing an increase in cases. Most states are. I think there are one or two in the very northeast corner of the country that are not. But we are all facing these increasing COVID cases in our states. The other challenge that states have is that we have to balance our budgets. Unlike the federal government, we cannot borrow. And in addition to this pandemic, Oregon has faced other challenges this year as well, from historic and devastating wildfires that have destroyed over 4,000 homes in this state and a number of communities, to the issues of social unrest. I think it's incumbent upon our federal government to get their act together and assist not only the states, but our local governments, our cities, our counties, our tribes, and of course, individuals that are struggling with the impacts of COVID-19. We know very, very clearly the Band-Aid has been ripped off, that our historically underserved communities, our communities of color, our low-income communities, our rural communities have been disproportionately impacted by this virus, by the wildfires. Congress needs to act to help us with additional dollars for public health and our COVID relief, but also to make sure that we can provide the services that Oregonians need.
Thanks, Brad, and thanks everyone. That's all the time that we have for questions.